Abortion pills will become more accessible in Australia under new eased restrictions, and it's about time. The Therapeutic Goods Administration announced on Tuesday that doctors and nurses who prescribe the pregnancy termination pill known as MS2 STEP and the chemist dispensing the medicine will no longer need to receive extra certification. The TGA will also remove the requirement for GPs to undertake mandatory training and special registration every 3 years. Under these new rules, which come into effect on August 1, the abortion pill will be as accessible as any other prescription medication. And experts have said this is a significant step forward because abortions in Australia may not be as accessible as people think they are. Abortion laws in Australia are written by state and territory governments, and in all jurisdictions, medical abortions with pills are legal up to 63 days or 9 weeks from gestation, but only with a prescription from a certified doctor. For surgical abortions, which can cost thousands of dollars, the limit can vary from 6 to 24 weeks from gestation before further approvals from doctors or medical bodies are legally required. And actually, WA is the only jurisdiction where abortions outside the legal window still fall under the criminal code. Currently in Australia, just 1 in 10 GPs are prescribers of the abortion drug MS2 STEP, and just 3 in 10 chemists carry it. This means about 30% of Australians with uteruses have no access to local providers of abortion care, and in remote areas it's even fewer, only about half can access treatment locally. The Royal Australian College of General Practitioners made this recommendation in a submission to the Senate Community Affairs Inquiry into Universal Access to Reproductive Healthcare back in December, and on Tuesday, President Dr. Nicole Higgins said it was extremely important because GPs are often the first port of call for people seeking support for an unplanned pregnancy. She said, "As a GP in a regional centre, I know all too well that there are significant barriers to reproductive care in rural and remote areas. These services are vital, and they must be affordable and accessible for anyone who needs them. Access to safe medical or surgical abortion services for women is part of a holistic approach to reproductive health. This is essential regardless of a woman's income or where she lives." And following the final report from the Senate Committee Inquiry, Assistant Minister for Health and Aged Care Jed Kearney said the federal government welcomed the changes that remove red tape and improve equitable access to healthcare for all Australians. She said, "We know that women experience structural barriers trying to access the healthcare they need, particularly in regional and rural areas. That's why it's so important that all health practitioners can perform the care that they are already trained to provide."